Hi, everyone. So I'm Denise, and I don't have slides because I just want to kind of tell you the story of our company and why we exist and how we help women all over the world through these critical life stages of becoming mothers and caring for their children. So our platform was formerly known as OB on the Go. We changed the name recently to Embrace Her because we are more than just obstetricians. My co-founders are obstetricians, reproductive doctors. We have a pediatrician as well. And we basically are experts in women's health, reproductive health, and maternal and child health. We believe that health is a birthright that starts at the very beginning of life, starting with really preconception, all throughout the 9 months of pregnancy, including the birth and the labor experience, and postpartum and beyond. And we also believe that the way a woman takes care of her own body, starting with adolescent, teen health, all through young womanhood, does have an impact on her future fertility and reproductive health. So my co-founders, Dr. Jan Rydfors was actually my obstetrician. I'm a mom of twins, boy-girl twins, who are now 6. He helped me conceive my twins 6 or so years ago, and I delivered them full term at 39.5 weeks, 2 vaginal births at 7 pounds, and that was probably the toughest thing I've ever done. And he is a professor of obstetrics at Stanford Medical Center, and he wrote the Clinician's Guide to Obstetrics, Gynecology, and Infertility, known as the Red Book. And so I, being a mother and a former patient of his, was really passionate about women's health. I went to Smith College. I've always been really passionate about women's health and women's rights, and I believe women's reproductive health really affects that globally. In college, I actually had my first ever experience of the U.S. healthcare system, and I had a gynecological emergency. Essentially, I had an emergency cyst removal, an ovarian cyst removed, which kind of opened my eyes to the whole healthcare system as a patient. And so I've always had a really strong passion for helping women take care of their health, take charge of their health from a very young age. And I didn't actually have a mom who taught me about women's cycles. I knew nothing about my own cycle as a woman, how periods worked, how ovulation worked, how to choose the right birth control, and how that might affect my future chances of getting pregnant. And so I learned it all from that book, Our Bodies, Ourselves, which is still in use today. And a majority of women I talk to, they say, yeah, I read that book too, and my mom never talked to me about this stuff. So we believe strongly in educating women from a very early age about women's reproductive health, and we believe the way to do that now with the millennials using mobile and just the whole world moving towards mobile first is to provide these health guides on mobile apps. So we have the first and only ever pregnancy application on iOS and Android that's been developed, written by board-certified obstetricians. Our primary channel for distributing our app is through physicians directly to their patients, because oftentimes your OBGYN is the first or second person that knows that you're pregnant. And so we are reaching moms at the first few days of their pregnancy to affect their health. So our mission is to empower women through every life stage, again, from early adolescence all the way through the mothering years to menopause. And so we're providing, tips, tools, tracking tools through our app, basically proactive advice and education for women at these various stages. So our pregnancy app specifically answers hundreds of questions that we know every woman asks during her pregnancy. We know this because our doctors get those questions every day. Same questions over and over again for very specific months and trimesters of the pregnancy. So we know the answers, and we're providing those answers through our mobile app. So we are not meant to replace a woman's obstetrician or physician by any means, but we know as OBGYNs that OBs are busy. They're running from birth to birth. They don't have a lot of time to spend with a woman who has lots of questions during her prenatal visits. Oftentimes, those visits last anywhere between 5 to 15 minutes if the woman's lucky. But a lot of women have way more questions that can be answered that can't be answered during an office visit. So we think our health platform is really important, and that we can really deliver high quality advice and proactive education to hundreds of millions of women really worldwide through the use of our mobile app. So just a little bit about why we're doing this. We believe very strongly, again, in women taking charge of their own reproductive health. We know that patients are really pushing the boundaries and educating themselves proactively online through the use of online sites, community forums, things like WebMD, Google searches, which doctors they kind of cringe. Don't stop searching Google. Stop going to those forums. Stop asking your girlfriend what you should be doing, because there's a lot of misinformation that women give each other, unfortunately, and that women find online about what to do and what not to do around their reproductive health, especially as it relates to getting pregnant, and being a mom. So one of the reasons that we're doing what we're doing, and that we're very passionate about this, is as OBGYNs, we know there is a global health crisis out there. There's sort of maternal child health mortality is still very high in developing countries. We think we can really impact that through the use of our app and through smartphone usage. And also, we know that there is an OBGYN crisis here in the U.S. So there are about 40 million women in the U.S. of childbearing age. There are about 30,000 OBGYN doctors serving those 40 million women. That number of OBGYN doctors is decreasing. Fewer and fewer residents are choosing the OB profession because it's a very tough profession to balance work-life. 80% of new OBGYNs graduating medical school now are women, which is awesome. But we also know that as women, they retire sooner than their male counterparts. They are downsizing their practices earlier on to manage the demands of motherhood, along with their medical practice. And 1 in 7 OBGYNs is no longer delivering babies, according to ACOG, which is the American College of OBGYNs. So there's a perfect storm happening in women's healthcare now and within the OBGYN profession that is causing a shortage. 20 states across the US are in crisis mode, meaning the demand for OB exceeds the supply. And so that's only getting worse now with Obamacare, with millions of new women flooding the system with, pretty high risk and high cost needs during pregnancy, birth, and beyond. And so this means that there's got to be a new way and a new paradigm for how we as women take charge of our own health and lean on, physicians and clinicians and the use of office visits and things like that to get our needs met, because the system is broken. We need more support, more proactive support. We need more than a 15-minute office visit for an annual visit with lots of questions. The internet and mobile is really bridging the gap for that, and we want to lead the way with a mobile-first health platform that connects mothers, women, doctors at very specific life stages with the right tools, the right advice at the right time for very little cost. And so that's what we're doing at Embrace Her. And I just want to share some statistics on OB, which I think could be interesting for you to know. So 30,000 OBGYNs in the U.S., 70 million OBGYN visits per year in the U.S. for 50 million women. 20 million of those are prenatal visits. 2 million of those are postpartum. So huge number of women having babies are not seeing their OBs postpartum. That's a problem, right? Because the women are falling through the cracks of care. Because once the baby arrives, it's all about the baby. Right, so the baby goes to pediatric visits, monthly or maybe every other month for the vaccinations. But what happens to the mother and the woman that has spent 9 months, incubating this baby and going through hormonal shifts and possibly having a really challenging labor and delivery? A lot of postpartum blues that go unaddressed, a lot of depression, a lot of challenges with breastfeeding and lactation, which we know is very important to women and to babies. But it's hard, and there's a gap in care. OBGYNs are not, kind of responsible for that postpartum period beyond the eight-week checkup. So what are we to do as a society, as women, as physicians, to really solve the problems that are not being solved right now? We think our platform can really make a big impact on women's health and moving towards that model of a woman taking care of her own health, being proactive about it, but also with the help of her own physician, face-to-face, as well as through mobile remote clinicians like as access through our app. So That's Embrace Her. We are looking for partners and in the fertility space, in the pregnancy and the pediatric postpartum phase. We're launching basically a whole new suite of apps over the next few months. We're raising money right now. We've been bootstrapped by our own physician team, which is great, but we're ready to scale. We have over 400,000 mothers and women who we've helped through our app in the last year, so 400,000 plus babies, which is great. The average OBGYN only sees a few hundred patients a year. So to serve that many women in as many countries as we're in English and Spanish, we're free. So anyone and every woman can and should use this. We're getting users as far as Africa, messaging our OBs. And so we're providing US, ACOG level standards and quality of care to the world. Women all over the world. And our vision is to really be a global health platform that connects women with physicians and clinicians and really high quality standard of care throughout their life cycle. So eventually we will be serving women all the way through menopause. So from motherhood, young womanhood through motherhood through menopause. And we want to be there for women at every step of their life stage. And we feel like there is really no one company in the health space that is doing this right now on a global scale and on a lifetime scale. Insurance companies don't do it. Your hospital doesn't do it. Your one doctor doesn't do it. So we want to do that for you and bridge that gap. So looking for partners, looking for customers, looking for people that are interested in joining us. We're hiring both on the technical side as well as on the marketing product side. Our team is very small and scrappy. We're looking for physician advisors as well. Who are passionate about this vision to take what we've learned as clinicians to a global scale. So thank you, and I look forward to your questions. We are self-funded. So our physicians have put in our own capital towards working capital to create our app and our platform. And we are raising $1 million seed round right now, first round of outside capital. We are, a few months short of profitability. We closed last year with over $250,000 in revenue. So we generate revenue in a few different ways. We have a premium version of our app that allows you to message a physician and receive a response within a couple days right now, but we're moving towards an instant response model with a third-party partner. So that's launching in a few weeks. We're very excited about that. We're also charging a subscription-based model for ask the doctor type questions. So again, not to supplant your own physician, but if you have the need to ask pediatric advice at 3 a.m. in the morning for $20, you can do that through our app. And then the third way we generate revenue currently primarily now is through sponsored advertising. So we're very selective. We don't want to be a baby center, or it's not eyeballs for ads. It's very curated, selected products, services, and partners that our clinicians vet. So it's doctor curated, recommended products and services for every life stage. So what would a pediatrician tell you to buy for a baby thermometer? What would an OBGYN tell you to buy for a bed rest tool? If you need compression stockings, what is recommended? So those types of very specialized products that are very clinical. So right now, our turnaround time is not guaranteed. It's about 24 hours, 12 on a good day. But our clinician team are practicing obstetricians, meaning they're running back and forth to births at any given moment. So their clinical practice takes priority right now, which is why we're looking to raise outside funding so that we can actually hire these OBGYNs, reproductive doctors, and so forth, these women that are downsizing their own practice, who want to remain involved in medicine in some way, who want to help. This is why physicians become physicians, right? It's not to manage an office practice. It's because they really want to help help women. So we think this is where OBGYN's going, right? So those women that are becoming mothers, they want to have involvement in medicine, but they want to do it flexibly, remotely. So we're creating on the back end, talk about it here. So we're consumer facing in the sense that we've got a patient facing app. But on the back end, we're building out a whole B2B physician platform to enable physicians with mobile tools to offer their own kind of concierge medicine, for example. I mean, that's where medicine is going. So we think that's really exciting. So our app is free. There's a $10 upgrade to the premium app, which allows you to start asking questions. Next month, as I mentioned, we're launching a third-party partnership, which allows a user to pay in advance for a set of questions, or a monthly subscription fee for either $9 or $19 to have, unlimited access, essentially. So for less than the price of a copay, $19, you can have a doctor in your pocket. That's cheaper. It's crazy, right? Because most of the time, as we've seen through, we've been answering questions through the app for a year and a half now. So we have thousands of questions in our database, pre-answered. I mean, OBs want this for their office. But what we know is a lot of the questions that come through are not questions that are medical. They're not really health related. They're women who are confused, who need support, who need a trusted ear, and just again are not getting that from their family or their friends or their own doctor. So that's bedside kind of we bottle up that bedside manner and we're just there for them, and that's what they're paying for. So in the case where a woman asks a question that can really only be answered by her own physician, we always refer back. Here's the general answer around that topic. You want to know what preeclampsia is, this is what it is. These are the warning signs. This is what you need to do if you have it. But talk to your physician and see if you have that, right? So we're getting them to their own doctor sooner. So reducing those risks and those costs of, the cost drivers, preeclampsia, preterm labor, right? Gestational diabetes. The sooner they can identify that, and a lot of it's education. They don't know any better, right? We as women, the first time you're pregnant, you have no clue what you're getting into, literally. Every day is different, and your pregnancy is going to be different from my pregnancy. So we're kind of like a guide, and we notify women of risk factors that they should be looking out for. And then we kind of give them the confidence to know, like, unless you see these things, you're probably okay. Stop worrying so much. Stop freaking out. Stop Googling. Stop Googling. So that's what we do. Any other questions? Okay.